Welcome, Health Revolution fam, to another episode of the Health Revolution podcast. Today we got the usual gang, Subash and Anthony, but however, we are joined by a special guest. Special guest is Kellen Cannon. She is a physical therapist and strength coach. She can kind of share a little bit more about that. Just a little bit more about how, so me and Anthony know Kellen personally through a community called Project Endure. You can kind of check them out on Instagram. We'll maybe link their Instagram in our bio. But a really cool group. They had an event, a meetup event last year in Philadelphia, and me and Anthony went, and we connected with Kellen. Then we went again just about a month ago and met up with her again. So that's how we know each other, and through social media, we kind of maintained connection and stuff like that. Um, but yeah, Kellen, why don't you just kind of introduce yourself to our audience?
Yeah, hello everyone. Thank you guys for having me. Obviously always exciting to talk to you guys. That's a pretty standard introduction. I'm a physical therapist and a strength and conditioning coach. I also work specifically a little bit more in the pelvic floor space, mainly in ortho and pelvic floor. And I have a background in performance physical therapy and just recently took on travel PT, and I'm currently starting my own virtual rehab and fitness business on the side while traveling. Um, I have been practicing for 4 years, and I have found that maybe some things that I was initially passionate about, I've shifted my perspective on, and that kind of led me down the road of travel. Um, People in the performance space don't typically endorse travel PT. And so that's kind of where my mindset was entering my profession. I was in insurance for about 8 months, did not like the structure of it, immediately had to abandon ship. I found a performance job in the city. I was living outside of Washington, D.C., jumped into that, loved it. It was amazing. I went from seeing 70 visits a week to about 25 visits a week on average or less. I had paid content time, paid workout time, hour lunches, really flexible PTO. It was a dream job. Um, and I was really in that mindset of like, I will never go back to insurance care. And life changes, your perspective shifts when you kind of open your brain to like what could possibly be. And I ended up taking the travel route about a year and a half into my performance gig. And I'm loving it. And I'm so thankful for the opportunity. And it's given me an opportunity to really dive into the pelvic health world, get into practice with it a little bit more, and really build a remote community that I'm loving. And I'm really loving the remote approach. Just about my personal life a little bit. I live in my camper with my husband and my cat. We rescued a senior cat about a year ago because we were like, we really need a camper cat to take on the road. So she loves it. She loves it. So we're in Texas, and we kind of just have been traveling, seeing national parks while in between contracts, getting a lot of time to just balance my occupation, but also vacation. And I'm really happy, and I'm excited to talk about some things in more detail with you guys.
Yeah, awesome. Thanks for sharing that. As far as like transitioning to travel, was it like more almost like a work-life balancing? Like, hey, yeah, this trip because you were at Big League Performance, right, in DC, which is a pretty well-known facility. I'm definitely aware of it. Was it almost like a work-life balancing where you're like, hey, I want to do this to kind of pursue things, or was it also like a professional career growth decision as well?
Yeah, definitely a valid question. Yes, I was at Big League Performance and Rehab with Mike Yassin in Washington, D.C., Capitol Hill to be specific. I loved that job, and it just goes to show how you can't pigeonhole too much in anything that you do, because I was not looking for a new job, but I do think sometimes things in life happen to kind of guide us where we're meant to go. And this just so happened when I decided I wanted to be a travel PT. I was in the airport in Maui, and my brother lives in Hawaii. So we were actually in the process of planning our wedding. I was engaged. We were getting married, I think, in the next like 6 to 9 months. And we were coming back from vacation from Maui. I was visiting with family. We had been taking off every 9-ish months to like go out to Hawaii, which, if you've ever been there, it's a long travel day. So you want to take off at least 10 days, and there's a lot of time. And so I was basically using all my PTO for Hawaii. And we're sitting in the airport. And I was like, what if we just like never had to leave? Like, what if I didn't have to go back to my
Yeah.
job? Like, and it seems unrealistic, but I was like, I had heard about travel and there's flexibility between contracts. And we're sitting in the airport killing time and I'm Googling it. And I reached out to a recruiter. I was like, I'm just going to put my info in. Like, I love my job right now, but there was a part of me that wasn't really loving just working in DC, working in a city area. There's different, um, obstacles that you combat, and the crime rates are high. And it really, city life was not for me. So I reached out to a recruiter, ended up getting a call from him on Monday. Like, recruiters, they are relentless. So one called me on Monday and I said, sure, let's set up a call. I'm not really interested in doing travel PT. I'm just curious. We got on a call on my lunch break. And by the end of that call, I was like, dang, I got to quit my job. And
Wow.
That
in that
good.
moment, yeah, no, like, and I was like, I simply can't reason with not doing this given the season of life I'm in. And I calculated and crunched some numbers, and I was like, realistically, I could take a contract and make more taking off a full 2 months for my wedding than I would make if I were to stay in my current gig. And it just did not make sense. Um, and that being said, I was a part of a small company that I was really loving, but the longer you're in it, the more you're tied in and connected to that business. And I was really looking to grow with that business if I were to stay, and I did not want to live in DC. And so between those two things, it was a really hard decision for me, but I thought about it for another week and I was like, dang, I got to talk to my boss. And like, we made it work, and I was able to work there part time. And I was just commuting while doing my first travel gig once a week out to Big League because I did love it so much being a part of the performance world. And I didn't want to lose that going back to insurance. But that's actually when Joe reached out to me. And so Matt touched on this earlier. We both kind of, well, we came together through the same fitness community. I know Anthony worked with Joe. I was working with Joe for about a year at that point. And I started thinking about travel. And, it's kind of like those little winks. He reached out. He's like, hey, how do you feel like being a coach under Project Endure? And I was like, this is sick because I don't have to give up the performance and fitness side of things that I love so much about PT. And it was kind of like that sign of like, okay, there's a way that I can do this and do all of this. And that kind of nudged me more further into that direction of like, all right, let's travel and let's do remote fitness.
Cool. Yeah, awesome. So a lot of things just kind of came together for you, but also like a perspective I'm hearing is like there's more to there's more to your identity than just work, right? You want to explore and see other parts of the world. And yeah, that's cool. Cool to hear
Yeah,
your thoughts there.
That's,
Um,
100%.
I want to
yeah,
add
so
in one thing
okay,
there
sure.
too.
Yeah.
I like that you added that because that was definitely something I was curious about. Just kind of like where are those pivotal moments in your career? And I know that you have your hand kind of like you're kind of do a lot of different things. And that was kind of one of the areas I was curious about how you got started. And I mean, that kind of just answered my question. That's really cool.
Feel like it's hard to beat that travel contracts, man. Like I have reached out to them once, like when I was in between job, and they were like just kind of, you're right, they're relentless. Like they just keep calling you, and then I'm like, man, if I wasn't so tied to this place, like I could just
Mhm.
like it would be pretty awesome. But yeah, man, that's awesome.
Cool. I think now we'll transition into maybe something a little bit more about you and your on through social media. You've shared your story about like your back pain, and kind of how it started, and kind of some of the dark places you were in with it, and now how you're kind of out on the other side of it now. If you just want to kind of share that journey, and if you want to just kind of start there, that'd be cool.
Yeah, definitely. And I feel like when you're a really passionate PT, I feel like it's more than just like I went to school for 3 years of grad school. It's kind of a seed that gets planted when you're younger, whether you were an athlete or you were an athlete who had an injury. I personally was not that person that got injured as a college or high school athlete and spent a lot of time at PT, and that's how I found PT. I actually found fitness before I found physical therapy, and I became so super passionate about fitness. I was an athlete my whole life. I played lacrosse and I played a number of sports, but lacrosse was my college sport. And so I went to school actually to pursue education, early childhood and special ed. And I picked a school based on that and also on lacrosse. I wanted to play lacrosse. So I ended up going to this D2 school in Pennsylvania. And so I was there for 2 years studying education. And on this lacrosse team, I was not seeing any playing time whatsoever, which is extremely discouraging when you come from one of the top athletes in high school. And then you hit the playing field. And of course, you're an underclassman. But one of my missions is always just to know that I'm doing everything in my power to be a force in whatever I do. And so that's kind of how I found fitness because I spent so much time on the bench. I was like, okay, what can I do about this? I was hitting the gym after practices. I was going to the gym after games because I was not playing. And it was frustrating. And at the same time, I wasn't feeling super passionate about education. And my older brother was in PT school at the time. And as I was getting into the gym, and we're talking like I was 18, 19 years old. And this was my first time, like really, truly lifting. My D2 lacrosse team didn't even have a strength and conditioning coach. Our coach would put together workouts. We didn't touch barbells. And I was like, I need to learn how to do this myself so I can get better. So I was asking my brother for help. And I would go to the gym, literally looked up the time that the gym opened and would go to the gym right when it opened because I was so embarrassed that people would like judge me, which of course, full circle moment. Now I'm coaching people to not worry about those fears because no one is paying attention and anyone in their right mind is supporting you. And it's like goes to show that we've all been there. We've all been like the newbie in the gym. So I found fitness through that and then learning from it from my brother in PT school. I was having a change of heart and I realized PT was kind of what I wanted to do. I was like, I love fitness. I love what it's done for me. It's taken me out of bad places mentally. It's that one tangible thing that I feel like I can control sometimes when life is hard. And I transferred and never looked back from that point. I was pursuing PT. And of course, nothing ever works out picture perfect. And it might feel like, oh, I had this passion and it ended up all working out and they were happily ever after. I went through PT school after newly being finished as a college athlete. And I feel like people don't talk about this enough, but when you spend your whole life being an athlete and then a college athlete, which is very much like a full-time job, but at the same time, you have this incredible community of some of your best friends to go through that season of life with you. And on top of that, I had an incredible coach that was always looking out for you. And she was such an amazing leader. And then you go from that and being super successful. We were winning conference championships. And next thing you know, you're not a college athlete anymore. You're entering PT school. And to put it quite plainly, no one really cares whether you sink or swim. When you're on a team, you're working for the greater good of the team. When you leave that team, I was with 42 people in my college cohort. And of course, our teachers wanted to see us pass because it was their job to teach us to pass. But at the end of the day, they reminded us quite frequently, like, if we aren't putting the work in, we're going to fail. And no one was checking in. And it was honestly very depressing for me. And it was something I struggled with a lot. And I didn't know how to make fitness work in with my balance in life. I was going through like a really ugly breakup at the time. I was really questioning my self-worth. And a lot of what I was doing exercise wise was punishing my body because I felt like I was being sedentary, because I was questioning my worth. And at the same time, on top of all this, I was failing classes. And I had never experienced anything like that in my life. And so that was step number one, questioning everything. And it was my first semester of PT school. Things kind of turned around second semester. I actually ended up meeting my husband now, and things got a little bit better. And I actually started working in group fitness. And I found that having a job outside of PT school actually helped me, even though everyone tells you not to work in PT school. And I think it was the best thing I ever did. And things kind of shifted for the better. Was I the best student in the class? Absolutely not. But I committed myself to being the most well-rounded and finished up PT school, was still really struggling with my training, started having back pain, and entered my first PT job with a lot of back pain, which turned into numbness and tingling down the legs. And I think a lot of it spiraled from years of just self-sabotage and not being self-aware of what my routine and how it was treating my body was doing to me. So that was step of questioning everything number two, brand new to my career. So what I learned through that though is like transitions are hard, and everyone goes through transitions in life, especially women. And recognizing that transitions are often some of the points where people quit from pursuing their potential was something I layered into my career. And I think it's become a huge part of who I practice now. And that is kind of like the evolution of how my passion has kind of shaped its way into also my business now. And so I ended up reaching out to Joe as like this last ditch effort of like, I want my body back. I want to feel like not necessarily in control, because you're never truly in control, but I want to feel like I'm taking active steps to better myself. Um, and since then, I have been training consistently for 2 years and truly managing my back pain. And now I get to help other people, specifically a lot of women, do that same exact thing. Women who are going through similar struggles to what I went through over the past, gosh, probably, 6 or 7 years now.
I'll
Awesome.
jump on that with a question, or more of a, I guess, a follow-up. Um, so one of the things I wanted to focus on was kind of like your I digging into a little bit about like your professional and personal like purpose and mission, and like you cover so much, and like I want to say just like you definitely are very open about sharing your story, and it's something I think I find very inspiring. And I can see how that would be like, I don't know, it almost like I guess it helps people to connect. It's something that's admiring. Um, I think the something I'm trying to grow as like as a clinician is like learning how to do that. Um, but I guess to you covered all of my questions that I had for like my professional purpose and personal. Could you talk more about like your current shift towards women's health and public health? Because I think that's something that I've noticed isn't seems new, and I'd love to know more about like what that work means to you.
Yeah, definitely. And yeah, you kind of highlighted how sometimes vulnerability can be a powerful part of our career. And I feel like that and those circumstances of like being vulnerable with my clientele has kind of pulled me in the direction of women's pelvic health and just women's health in general. Something that I find myself saying on repeat, especially when I'm in evals with women for pelvic dysfunction or maybe low back pain, and honestly, even some of my more mainstream ortho clients and patients, something I constantly say is, wow, I really wish you could hear other people talking about similar things they're going through, because if only you could see that so many of you guys are going through similar things. And I don't know about you guys, like as a PT, but I get a lot of tears in evals. Like intermittently, there will be tears. And a lot of them are surrounding these frustrations and feelings of loneliness and feeling like there's no other side to whatever they're going through. And I think there's comfort in knowing that while these things are not normal that you're going through, they're not uncommon. And just like you are feeling this way right now, I have felt that way alongside of you. I have felt like there is no other side. And simply because I'm sitting here as your provider, I am just as much human as you are. And if I am able to see another side, and if I am able to see other people see other sides of this, there's no reason why you can't either. And sometimes people just need to have their footing, right? They don't even know what ground they're standing on. And this all kind of cycles into like, okay, self awareness. Are we even aware of our anatomy well enough to know where to head next? And that is a common problem in women. They have no idea how to control their own anatomy. And there's a lot of transitions when it comes to being women, which I touched on earlier. You're talking about pregnancy, postpartum is also a huge part of it. Women also have a stark drop off in their hormones in menopause, and all of these things do matter, and they all come with symptoms that can present themselves as orthopedic symptoms.
Right.
And the reason why I'm so drawn to this population, and especially now, and this is why I'm also still passionate about the insurance based world, is because I constantly get evals for women with low back pain or hip pain, or maybe even sometimes it's knee pain. And you're reading some of their medical documentation and you're seeing they have issues with constipation. They are worried about weight loss and they don't need to be losing any weight. They need to be increasing muscle. They're
Right.
having leakage and incontinence. They're having all these not red flags, but yellow flags. Like, for example, women with back pain that started when they had C-sections 10 years ago. We need to be screening their pelvic floor.
Right.
And doctors still don't understand what that looks like and who is the appropriate clientele. So educating doctors on like, these are the people I work with. Please send me referrals.
Right. That's hearing you talk about these things like it's like it's clicking a lot about because like actually let me back up. I think it really reminds me of two things. One is that back when we were still in school, there was a book that we had to read. I think it was called like When You Fall, a Spirit Catches You or something like that. I don't know, Matt and Anthony, you guys remember, but essentially the book was talking about this Navajo uh, tribe member who became a physician, right?
Mm,
And she was like ill, had to go through like, was admitted and it was going through like very severe like health crisis. And then, which she came out saying that like, I feel much better as a practitioner, a lot more confident treating my patients because I have gone through similar situations.
mhm,
And the things that you were describing are like pretty much like, okay, look, man, my experience, right? You as an athlete, as someone that is like, living with uh pain, back pain for a long time, being a woman living with that pain, like I feel like you are in such a like a good position to be to give care because like one of my first job that I had was I was at an outpatient settings community health outpatient settings and it was funded by grants and so like we didn't really look at insurance much but it was just like community right whoever when you want needed help and the patient populations that I used to get a lot was anywhere from like 20 to 40-year women that was like my prime patient populations and dealing with chronic pain on postpartum, like, pregnancy, incontinence, like things like that, right? And I'm over there, I'm like, one, I don't know. I mean, I know about it, but I feel like because I do not experience these things,
mhm,
like I am so underqualified to like even give you advices or even give you recommendations to treat. And I took the easy way out and said, hey, if you have insurance, here's the public floor specialist that you can go see. And on the people that didn't have insurance and that, I was the only one providing care. I felt very, very, very uncomfortable treating that sort of populations because like I'm just like I think this is what we should be doing, and yeah, it's truly amazing that you are sharing all that. Um, I don't know, Anthony, Matt, do you have more questions on and a little bit background because before I move on to the different sections, I just wanted to say that.
I'd say that I think about that as well in my own practice. There's so many niche areas that it's good to be aware of as a clinician. Women's health specifically, because that is a huge population of people we work with. I mean, I'll see people come in for SI pain or like low back pain. It's like there's all so many dynamics or angles to approach things from, but having kind of the nuance to communicate and listen is really helpful. And it's really hard to sometimes. I tend to really enjoy working with runners, and that's an area that I'm trying to challenge myself in to listen more, to pick on up on nuances. That tends to be the population that I'm the hardest on myself with. If I feel like maybe we don't do things quite the right way, or their care is not going the right way. Um, but yeah, it's interesting and it's really cool to see that there's people in practice that um, have that experience and that you can direct people to, you can look to for help. Um, and yeah, no, it's encouraging, and I like hearing that, like
Yeah.
your story and angle.
I really like what you said, Anthony. Like listening, I feel like one of the biggest thing that I've like have come out of like being a physical therapist for the past 3 years was like if I just sat there and listened to them, because a lot of the times when people come to us, it has been they have gone through this whole healthcare systems, like, of like, hey, go over there, do that, do this, that doesn't work out, or like that's bad for you. And then I don't know. I mean, I know why the US healthcare system is just kind of like all messed because of specialty and things like that. And by the time they get to us, we're like the last person to see them. And like you're saying that you don't just want to be that another person of like, hey, you're doing these things wrong, or like maybe go see other persons, like, which, when I first started, I was taking the easy way out doing that. But nowadays, like I find it like a lot more, even if I don't know what I'm doing, just if I sit there and listen and acknowledging them and kind of figuring out, hey, let's figure it out together, right? And I mean, we know ultimately movement is what one of the things that's going to really help you, right, get better, right? And but there's some nuance to that, and but the biggest part about learning about listening and acknowledging them, like I feel like that was like a game changer in like my practice, really.
100%. And I will also say, when it comes to pelvic health, unfortunately, like the bar is kind of low. Any bit of knowledge that you guys can get about it, and you don't even have to like dive into the internal route. You don't have to get trained in that. If you can even provide education, a lot of pelvic health is education. And there's a lot of really great remote courses that I recommend to a lot of my friends who reach out to me.
Right,
ICE is one of them. Institute of Clinical Excellence has a really
right,
nice remote course that actually is geared towards CrossFit athletes too, which is I love their courses
right.
because they're all geared towards active adults. So look into some of those courses, and I'm happy to offer more. So I'm always open as a resource, like reach out and I can point you in the right
Yeah.
direction.
Definitely. I think I may be definitely reaching out to you because like not just like I mean I don't work in outpatient settings anymore. I'm in home health, like primarily seeing patients that's just been discharged. And but incontinence and things like that is so common there. And it also feels like, because I'm a man, right? And talking to a woman about these things are very, very uncomfortable. So I mean, like, resources would be very helpful.
And I
Um,
will also say there are screening lists. And I always tell people if all you can do is screen to see if pelvic floor is a part of it, you are doing more than most. And the reason why I say that is because I sometimes get back pain evals that have incontinence present, and they will suggest back surgery to fix the incontinence without screening pelvic floor. So if you can at least go through even a checklist if you're uncomfortable, print it out, say, these are the points I'm going to hit, and if these are factors, we need to clear the pelvic floor before we go and get a back surgery.
yeah,
Sometimes it's just like, let's do the bare minimum so we don't set someone else up or set someone up for a surgery that's not going to fix their problems and could create more problems. That's all.
100%. Yeah,
That's my last
100%.
plug.
Yeah. I want to shift just a little bit into your projects that you've been working on, right? You mentioned that, I feel like the things that I've described has like kind of perfectly set you up to do into building your own space, right? You mentioned that remote online business that you've been working on. Like, what has been like your journey been like that? What are the biggest barriers that you've encountered, right? Things to navigate that. Like, I know. I mean, we're like our three of us are like really trying not to like, come off as like, hey, physical therapy, you gotta buy this to sell that, right? Like, like we're trying to build a community just like how you're trying, like, you've been doing for most of your career. Like, I would love to learn more about that. Yeah.
Yeah. So I, you mentioned how like I like do wear my heart on my sleeve in terms of like I'm very vulnerable and I'm very open with people. I have noticed that is a strength of mine, and it's not something I've always seen as a strength. There are people that say, you know what, you like share too much, you're too much of this. But at the same time, I will say that's been a big part of my journey. I've always been sharing my fitness and my pain on social media. It's what I do for a career. It's something I was struggling with personally. And the reason why I share so much is because I see so many people struggling in silence over it. And it makes me sad for people to think that they don't have anyone to reach out to. So I always like to be that person that I'm like, look, you can always reach out to me. So I've always done that, and I think that's actually helped me. And I feel like some of the biggest barriers you asked about in terms of starting my own thing, imposter syndrome,
Oh
100%.
yeah.
Everyone has it. And when I started training with Joe said, you want to start training with me? I'm like, yeah, sure, I'm open to it. And I was like, I'm so busy right now. Like, I'm good. Like, I don't really need to train any clients, but it could be fun. And I announced that I was taking clients, and I think I had like three in the first month that were reaching out to me. And I was on the phone with them talking about some stuff they're going through and how do we get you back into things. And so you think people aren't watching, and people are always watching. And once you build that trust in a community online, people are going to be taking in the info. And there are people who are silently probably watching you that you don't even realize they're going through the same things. And I had people that had never interacted with any of my posts that were sliding into my inbox and saying, I'm struggling with XYZ. It's very similar to what you're going through. Where do I begin? And so that is kind of like a message on imposter syndrome. And
Right.
I think we don't give ourselves enough credit for what we do. And so that was kind of the first step. Was I started taking on those fitness clients and started building those. After I started building fitness clients, I started talking more about pelvic health and like low back pain and my journey with that. And people started reaching out to me about pelvic health. I took a pregnancy and postpartum fitness course, which put me on like a map um, that the coach that offers this course has. And so people were finding me through that. And people started reaching out to me. So I was like, I need to start offering this as a service, because you would be shocked at how many people actually like we truly do live in an echo chamber when we're PTs. We're surrounded by other PTs, other people in fitness, and we think all of our stuff is common sense. We truly do. And then you realize when you get into like when you step outside of that box, you're like, wow, there is so much bad information out there, and it's literally nationwide. And that's kind of how I started building my clientele. And obviously imposter syndrome still pops up, but my question was, if you don't do it, who else is going to do it? Someone else is going to do it, right?
Love that.
And
Yeah.
so I was kind of like, yeah, if not me, then who else sometimes? Who are they
Love
going to fall
that.
into the hands to? So,
Yeah.
yeah.
I love that. Like, if not me, then who, right? Like, you might as
Mhm.
well be the person to be the one that provides care. Because, I feel like if you have that set standards and drives that like to be the best, it could really truly make a difference. I do have a question about like online treatment and evaluations. Like, how was that process for you? Because like I feel like there's a common misconceptions, right, in physical therapies that you need to be in person, right?
Mhm.
And you need to touch someone to be able to provide the most accurate evaluations or like you be able to give most accurate recommendations. What has your experience been like that over there?
Yeah. So, for one, when I first started with fitness coaching, I found a lot of what I do as a physical therapist was bleeding into my fitness coaching naturally. And after coming out of 2 years in the performance world, I largely am not a hands-on practitioner. That's just not how I operate. If I have to, like if I think that there's a belief system there that they feel like they need to be hands-on, or if there are reasons for it, I'm going to use it. I'm not going to like run away from it. Like, I think
Right,
manual has a time and place. But here's the
right.
other thing: people in the online space aren't coming to you for hands on care.
100%. Yeah.
They're really not. They're not coming for hands on care. And I even worked as a fitness coach in person for, I don't know, probably like, 2, 3 years before that. And I found a lot of the time that you spend in person training people, you're kind of just like, bantering with them and you're chatting, and that's cool too. Like, I think
Right,
that's great. But the longer I was in the profession, the less I was like, I need to be hands on with this person so they know how to move their body. Because at the
right.
end of the day, you need that person to figure out how to use their body themselves. Like, that
100%.
is the end
Yeah.
goal. And I felt like a lot of time in person. And obviously, in the insurance world, we're taught that our services are valuable because there's time attached to them, right?
Right.
There's time
Yeah.
that we are spent with that person attached to them. And that's how insurance teams are work. In the clinic, how much of that time, if you have 30 minutes to an hour with a patient, I want you to truly think about like what is valuable about that session.
100%.
And I found that there, especially the complex patients, we're spending way more time talking about their life and what's happening outside of PT than I am making sure their pelvis is perfectly rotated to create the perfect squat and they are breathing with the right patterns. And like, you know what that does to people? It confuses people, it overwhelms them, and it makes them think that fitness is hard. And it's like, no, fitness is
Right.
for everyone, and your body is smart enough to figure it out. So empowering them to do the workouts on their own. And then I say to them, you tell me if you're struggling, if it feels off, if it doesn't feel controlled, if you feel like it's missing something, text me. We look at a video. I give some cues. I'll send a video back if it's warranted. And that's kind of how we communicate outside of sessions. And as for like seeing them for the first time, I mean, evals, I see people move and we look at like range of motion restrictions, compensations, and within like that first subjective, I find subjectives are the most important part of the eval anyway.
Right.
And we're able to tailor a plan for them to get their foot in the door for fitness. And so a
Right.
lot of what I do in the rehab world, it's coaching, it's fitness, but with pain.
Yeah. I love that. Like I feel like therapeutic rapport that, like I feel I think the way that our whole education is set up is that like we are taught to think biomechanically and t taught to look at like, what is wrong, right? And oftentimes that is almost to me, at least after, being in physical therapy for a while, like almost feels like that's just so little part of physical therapy that,
Mhm.
there's so many other things that, like how you're mentioning, being able to talk to them and really, figure out what is going on, learn about them, right? Just changes the whole world, right?
Mhm. Yeah.
I,
And at the end of the day, like I feel like unfortunately that turns into us disempowering people to think that they need us.
right.
And I like to look at it the other way around.
I 100% agree. I feel like any good clinicians nowadays, like, like exactly what you're saying. Like, I feel like once we recognize the power of that, like, it just changes your whole practice. Um, you did mention something about that. I thought I found it a little curious, is that you said that you advocate for health insurance, right? Am I like, you know, like, I wanted to ask you about that. Because one of the questions that we've been asking our guests that's been coming around is like, what do you think about our healthcare systems, right? What could you change, right? And oftentimes they're like, okay, we don't like the things that they're doing, this stuff. Like, obviously that's true, right? And because
Mhm.
they don't want to pay for physical therapy.
Hmm.
Um, like
Hmm.
I wanna hear more about that. Like, would you wanna like, just share like what are your thought process behind it?
Yeah, I mean, I like working with insurance because it allows me to work with a variety of people.
Yeah,
I like working with people of all ages, of all backgrounds, of all contexts. I don't like insurance because I don't like seeing people, 10 years after they had pain and they've been getting injections and they've gotten imaging and they've gotten all this treatment, right? All this treatment. It's like, okay, why aren't you better? Why aren't you feeling good? You know?
yeah,
And I don't like, seeing women come in and they're like, I'm on osteoporosis meds
right.
because my bone density is low. And I'm like, oh, did the doctor suggest, maybe some strength training? No. Okay.
Yeah,
Well, I don't like that part either. Did the doctor, send you to a nutritionist? No, like they just tell me to lose weight. Okay, I don't like that part either. Because a lot of times, this is so crazy, but I feel like, especially in women don't, I mean, like, you could ask all your women in the clinic, are you comfortable with your body? And maybe they kind of dish on this to me because we're just fellow girls, they're like, I'm so fat, like, I need to lose weight. Why is that a common theme in women? We all just want to lose weight no matter how old we are, no matter how good we look. And half the time I'm telling them they need to eat more, they need more protein. It's not like you're snacking on empty calories and you're not getting your protein. So let's think about it as, what do we need to add to our diet versus what do we need to take away? So all of this, like, information about like what just like makes a healthy body, eating right, sleeping right, managing our stress, and finding a consistent exercise routine that we enjoy and makes us feel good. We
right.
don't talk about that in healthcare. We give them
No,
medications and then maybe we send them to PT and then we maybe talk about surgery. So yeah,
right.
we could talk about this all day. There's a lot I don't like about insurance, but I do like that it gives me access for now. But honestly, the way that insurance is going, I could see it becoming less prevalent because
Yeah.
they're already talking about like Medicare cuts, for example.
Yep.
I think that's going to impact accessibility. And that's why
Hmm.
I've gotten my foot in the door in the online space. One, because it makes it more affordable.
Yeah.
And two, I think a lot of people, even my age, don't have good enough insurance to even get PT unless it's going to be out of pocket. So they might as well pay for someone out of pocket that insurance doesn't have its grubby little hands all over, and they
Right.
actually get what they're paying for.
Yeah. I like that because like I think the way what I'm hearing is like you're looking at in a stance of accessibility because it does, even with all of its, negative aspect of health insurance, it does really provide us with the accessibility to come see us, right? And so that is huge. As much as we don't like it, if we can get them to our side, that'd be awesome. But no, I totally understand. Like, I love that you're already thinking about 5 step ahead of time, like like with the regulations and legislations that's going on. It's just it truly, unfortunately, it does affect our professions. Like, I think about us as like, medicine 3.0, where like we're in the forefront of like preventing chronic conditions, right? Like how to make kind of separate ourselves from like just taking medications and letting our body do a lot of the things that we know is capable of doing and finding out more and more that we don't necessarily need surgeries and medications to just heal, right? And reliance on that. And so I feel like we are in such a this space, but the insurance companies which our country runs on just is really just straying away from it. But thank you for sharing. I think that was amazing. I think I'm gonna move on from that. I'm gonna let Matt over to he has a couple of things.
Yeah, I mean, I ton of great points. I think what I really liked is you kind of sharing your philosophy. Excellent narratives. We're all about pushing good narratives, lowering the barriers to physical activity, which sounds like Kellen's doing an epic job of. Um, did you guys have anything else you guys wanted to ask specifically, Anthony and Sue?
No other questions. I just thank you for the work you're doing.
Okay.
Uh, yeah,
Yeah.
that's all I got.
One thing I did want to touch on is, so Cal, if people want to reach out, say they want to, maybe they have questions about women's health or just general fitness, Kellen is a beast, so I'd highly recommend you reaching out about that. Where's a good place to contact you for that, for our followers?
Yeah, definitely Instagram. My handle is Kellen Cannon, KELLENCANNON .DPT. And my business is called Built. That's at Built for Her PT. So I'm pretty active on Instagram. So always open to answer questions. I love meeting people on social media.
Can confirm. She is timely with her DM responses as well. Um, yeah, Sue, maybe you can link that in the
Yes, we'll do
when
that.
this comes out. We'll link her
Yeah.
Insta. One last thing is, what are you training for right now? What's going on what's your training looking like?
So, my training right now, I just started messing around with some CrossFit. Part of my whole back pain journey is I want to be able to jump into group fitness when I feel like it. So, I've been messing with that. I train about 6 days a week. I'm currently doing about 14, 15 miles a week with 3 days of strength training.
Wow.
And I'm training for the New York City Marathon, which is in early November, and that's in 2025. I'm fundraising for endometriosis, so the Endometriosis Foundation of America,
That's
to help
amazing.
women who deal with pelvic pain and all sorts of things that they're not getting the help that they need on. So it's a big part of what I do for my work. So I was like, this is a good mission to support, and I'm really excited.
That's
Hell yeah.
awesome.
Are you
Yeah,
raising
guys.
any money for your run?
Have I raised any money?
Yeah, you're fundraising.
I haven't. Okay, so like I just got confirmed like last week or maybe the week before. So it's in the works, but I will be fundraising all summer.
I mean,
Cool.
if we can support, let us know.
Yeah.
Sure thing. Appreciate you guys.
Sweet. But yeah, cool. People go followers go follow Kellen. She got great training advice, excellent narratives, and you can learn a lot. She trains really hard, so go do that. But yeah, guys, thanks for tuning in. We hope today's Friday. Have a good Friday. Have a great weekend, and we'll see you on the next one.